This is the newest member of the Saeed family. Yusuf is just 2 weeks old. His parents are smitten. But his entry into the world didn't go as it should. His dad wasn't even allowed to be there.
At about 9 o'clock when the baby was born, I heard his cry. It was very short and I hadn't realised it at the time. So I only realised about 20 minutes later when my wife picked up the phone and told me that baby was born.
The official COVID guidelines say that partners are allowed to be present throughout labour. We'll tell that to the Saeeds.
It was whipped cross where I gave birth to my third kid. When you are like having such a hard time, you want someone to be with you at that time. And unfortunately, it didn't happen. Like my husband wasn't there.
My understanding is that most hospitals will let them in for some of the labour at least, but that didn't happen to you.
Yeah, did allow only during the labour part. Like if you are in labour ward, then they allow your partner to be there with you. But unfortunately, there was no space in the labour ward, and I was there in the mulberry ward, and they said it is against the protocol. They can't let my husband come in. So during whole time, I was alone.
Yeah, and obviously, giving birth is
It's a great thing, yeah.
It's a difficult thing to go through.
Initially, I asked them for like epidural. That was my plan, and they said okay, they will do something about that. But then they had something else in their minds, and they didn't give me epidural, and they said okay, we can give you diamorphine instead. And they went to take diamorphine. It literally took them 1 hour, and no one came back. And in that 1 hour, I delivered my baby on my own, and there was no one by my side. And it was really difficult for me, and I can't even express in words how painful it was. And it was really miserable.
Do you feel that with COVID-19, with coronavirus, it's almost like some hospitals have swung too far? They're not thinking about the other patients that they need to look after.
Yeah, partner sport is really, it's really important, and they should care. Even they should care more about the patient. But I think they are more stressful because of understaffing, because of, I don't know what kind, either they are getting good budget for their hospitals or not, but they are understaffed there. I could see there.
Whipps Cross Hospital are now looking into the complaint. A spokesperson for Barts Health NHS Trust, which manages the hospital, said, "We're deeply sorry to hear about the concerns raised by Rahan Saeed and Iram Saeed regarding the care received during the birth of their child, and have offered to meet the family to discuss their concerns. To keep patients, staff and visitors safe during the pandemic, we've had to restrict families visiting our hospital, but an exception has been made so that partners can attend 12 and 20-week scans, as well as throughout labour and birth." Whipps Cross isn't the only hospital to restrict visitors to maternity services during the pandemic. In September, new guidance was issued asking trusts to relax visiting restrictions so partners can attend maternity units for appointments and births. But it seems the advice is being applied inconsistently. Data compiled by The Guardian last month showed only 23% of trusts are allowing partners to attend the whole labour, and half of women are having to attend scan appointments alone. Since I started looking into this issue, I've been really moved by some of the stories that I've heard. Women having to give birth alone, but also the impact that COVID has had on miscarriages and stillbirths, and scan appointments too. When a pregnancy goes smoothly, it might not be a big deal if a partner can't come along to a scan appointment. But when things go wrong, forcing women to hear very bad news on their own without a hand to hold, that there's no heartbeat or that their baby is very sick and the very worst decisions have to be made, well, that feels very cruel. The baby loss charity Tommy's has reported an 88% increase to their helpline since the start of lockdown.
This decision to ban partners or temporarily ban partners from scans is done by trust basis. So some trusts might feel that, you know, that the time has now come that they're allowing partners to come back into the scan room. And in my London trust, we are doing that for the 12-week scan, which is really great for those families. But I think what people find hard is knowing that, you know, in the trust over the way where they're not having care, women can have their partners with them, and in their own trust they might still be not able to do that.
Now politicians are calling for change.
I'm disappointed that we haven't sorted this problem out, and the heart of this issue is not just the obvious thing that this is the most special moment in your life and you want to have your loved one with you. It's also, sadly, a moment where things can go wrong, and you can have a stillbirth, you can have, sadly, a baby who's born and doesn't make it, and that is really a moment when you have to have a loved one with you. And we on the Select Committee heard some very harrowing stories.
The guidance obviously has changed to try and get trusts to find a way of introducing partners to the appointments and to the birth, the whole of the birth, but it feels like a bit of a postcode lottery.
Well, I think that's right, and the reason why it's taken longer is because hospitals, absolutely rightly, are focused on infection prevention. And we know that about 70% of the people with COVID have no symptoms at all. But there's a very simple solution, which is just to say whoever your significant other is, they should get a test. And once they've tested negative, they can then accompany the mother at all stages of the pregnancy. And that's what we need to sort out.
Are you worried that some trusts might be tightening the rules again?
Well, I think trusts will have to tighten rules as the infection rates start to go up really around the whole country.
Would you support the idea of another national lockdown?
Well, I'm always in favour of taking decisive action earlier. I think we did lockdown too late in the first time. I think it's a very finely balanced judgment on this occasion because you do have some parts of the country with relatively low infection rates, and I think I'd be guided by what the scientists are saying.
Rising COVID cases could mean renewed restrictions. Liverpool Women's Hospital has temporarily stopped antenatal and postnatal visits. Half of NHS trusts say they would consider tightening the rules in the event of rising rates. The situation could get worse before it gets better.